And as far as the biomarker testing's role, it's really critical to identify those mutations that are found that are driving the cancer's growth and guide the personalized treatment based on those results. And important to remember too, early testing is really crucial for patients with non-small cell lung cancer. In studies, it's been found to be associated with improved survival outcomes and reduced mortality.
You're listening to the ONS Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Hello and welcome to the ONS Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Vicki Doctor, Precision Medicine Director at City of Hope for the Atlanta, Chicago, and Phoenix locations, about the oncology nurse's role in biomarker testing for non-small cell lung cancer. This podcast episode was produced by ONS and sponsored by Lilly Oncology. ONS is solely responsible for the criteria, objectives, content, quality, and scientific integrity of its programs and publications. Welcome and thanks so much for joining us today, Vicki.
Thanks, Jamie. I'm really excited to be here. This is my favorite topic to talk about, precision medicine and how it helps patients.
Outstanding. Well, let's start out with just talking about kind of the lay of the land. What is the current landscape for non-small cell lung cancer treatment? And why is biomarker testing becoming increasingly important?
Over the last 10 years, the landscape for treating patients who have non-small cell lung cancer has really shifted from a one-size-fits-all approach to what we now refer to precision medicine. So doing these molecular tests that help identify the targeted therapies and immunotherapies that patients with non-small cell lung cancer can respond to really complements the traditional chemotherapy and radiation, which was really the only thing that we had in our toolbox prior to 10 years ago for treating patients with this disease. And as far as the biomarker testing's role, it's really critical to identify those mutations that are found that are driving the cancer's growth and guide the personalized treatment based on those results. And important to remember too, early testing, and I'll talk about this probably more in some of the other questions you'll ask me, but early testing is really crucial for patients with non-small cell lung cancer. In studies, it's been found to be associated with improved survival outcomes and reduced mortality.
So let's talk just a little bit briefly about what biomarkers are. What are they, and what are some of the key biomarkers that we are likely to see when caring for patients with non-small cell lung cancer?
Biomarkers are really just a biological molecule that are found in our body in blood or tissue, and they could be genes, proteins that genes express, or molecules. And these biomarkers are used to provide information about cancer's characteristics or behavior. And in precision medicine and oncology precision medicine specifically, molecular tests can help with diagnosing a cancer that maybe it's an unknown primary. It can help with monitoring response to therapy, detect recurrence of disease before other tests can find that, predict prognosis or how aggressive the cancer may be. And then what I think we're going to focus mostly on in this podcast is guiding treatment decisions for targeted therapies. And some of the key biomarkers that is recommended by the NCCN that are to be tested in patients who have non-small cell lung cancer are EGFR, ALK, KRAS, BRAF, MET exon 14 skipping mutation, HER2, which is a protein expression from an ERBB protein, PD-L1, which is a protein expression that's used to guide immunotherapy choices. And then finally, there's 3 fusions, ROS1, RET, and NTRK, that are pretty rare, but really important to be tested for in patients who have non-small cell lung cancer, because each of them have a targeted therapy that, even though the fusion may be rare, the targeted therapy has been developed to target that fusion and hopefully have a good outcome for a patient.
And so how do these biomarkers impact a patient's prognosis and help to identify their treatment options for these patients that we're caring for with non-small cell lung cancer?
So as I mentioned before, when these tests are done and targetable mutations are found and the targeted therapy is given, studies have shown that there's better outcomes when treated with these corresponding therapies. The biomarkers that are found on the molecular test are sometimes also referred to as pathogenic variants or variants, help with treatment decisions. So it can lead to knowing that a patient may be eligible for a targeted drug such as osimertinib for a patient who has a certain EGFR mutation, or in the instance of immunotherapies, if they have a high PD-L1 expression, pembrolizumab may be the best choice for the patient. The other important thing about these treatment decisions that physicians are making based on the molecular test is many of the molecular tests out there in the market actually have companion diagnostic approvals, otherwise known as in an acronym as CDX, and you'll see these on these test results. And what that means is the FDA has actually given their approval for this test to find the biomarker or the pathogenic variant that certain targeted therapy will work with. So it's important to understand what that acronym means when you see it.
Thank you for that. We've seen biomarkers. They've been around for a little while now. We can't say they're new anymore, but I do think that they still present challenges for nurses that, many of us in nursing school, we don't get this type of content in our curriculum, understanding the genomic underpinnings of anything really, but cancer especially, even for nurses who have been in practice for quite some time, this is still feels new, I think, to a lot of us. And so certainly something that we as nurses have to intentionally learn about and continue to study and to incorporate into our awareness as we care for our patients. So what do you see as some of the challenges that we as nurses might face when trying to review and interpret or explain these biomarker test results to our patients?
Absolutely. I can't agree more with what you just said as far as nurses that are working today that maybe graduated from nursing school more than 5 years ago, that this content is not in the curriculum. So the complexity of it for someone who is a nurse that maybe has worked in a different field and then is now entering oncology, or maybe someone who even just newly graduated, that it's a very complex topic. So it's important, and it is a challenge to understand the terminology and to be able to translate that in a way to a patient so they can understand it. So that definitely is a challenge, something that I work really hard at where I work to make sure that the nurses really understand this content so they can explain it to the patients. Because oftentimes the patient will come out of a room after having a meeting with their physician, hearing about the test results, hearing about the treatment plan with the targeted therapy, and we're so overwhelmed, maybe they didn't hear everything. So then it's the nurse's role to jump in and explain this very complex content to patients. Another important challenge for nurses related to this topic is just these results may not reveal a targeted mutation for the patient, and that could be very disappointing. So being able to provide that emotional support to patient if they have that result come back saying, actually there's no targetable mutation. So you can actually reinforce with them that if you go on to another treatment that the physician decides to put you on, the tumor can change. The new pathogenic variants can develop based on the treatment that they're getting, and another test can be done. And maybe at that time, a new biomarker that could be targeted would be seen on a new test. And then finally, another challenge for nurses in explaining these results to patients is making sure that the patients understand that timing is important, that we get the test done quickly after diagnosis or progression, but that we need to wait for those results to come back. That's sometimes difficult for patients who want to start treatment right away, but it is really important that we wait for the results so we know the best first treatment for that patient to get in their treatment journey.
Thank you for sharing that. I think, all of those are very important and I think very unique nursing responsibilities. As you mentioned, we serve as that translator sometimes of trying to help interpret information, complex information in a way that patients can kind of wrap their minds around. And we do that sort of no matter what specialty you work in. I think that's just part of nursing. But, you make some great points about being able to prepare the patient for whatever the result could be, whether that's, yes, we found something and that might lead us to a different therapy, or no, we didn't find something, but that doesn't mean that there aren't other therapies or that we might not test again later and find a therapy at that point. And so just being able to kind of shepherd them through those emotions that they have when they do get those results back. And then finally, as you said, it can take time to get these results back depending on where you send them or kind of what those circumstances are, but how important it is to wait because it really could change the trajectory of their treatment path. And so all great reminders for nurses to be aware of when they're counseling patients through biomarker testing. Beyond those responsibilities, what other specific roles and responsibilities do you see oncology nurses playing in the whole sort of molecular testing, biomarker testing process, from specimen collection all the way to the education that we've kind of already touched on?
Definitely specimen collection is an important part of this process, especially if sometimes for these molecular tests, you can send a tumor tissue sample, but you can also possibly send a blood sample. It would definitely be in the realm of possibilities that that nurse could be collecting a blood sample for the test. And obviously that you want to make sure that you're collecting the correct sample and the correct tube, labeling everything correctly and filling out the paperwork that will accompany it, but also if there is a consent involved, making sure that you go over the consent with the patient. As far as tissue specimen collection, typically that wouldn't fall to the nurse to actually gather that specimen sample, but it is a role of the nurse in this process to communicate and talk with the pathology team at her hospital, as well as the oncologist ordering the test to make sure that that's a smooth process. So we want to make sure that that test result gets back to us as quickly as possible. So in order to make sure that that happens, communication with the whole team is important. And then obviously education that have already touched on and advocacy to making sure that the patient understands not only the purpose and the process and the implications of this test that we're doing as far as educating them, but also making sure that they understand the timeliness of the test and that we need to wait for those results to come back, as I mentioned before.
And then just to review, how can nurses best support patients and their families when these test results do come back that are perhaps inconclusive? Maybe they indicate that there is no available targeted treatment for their cancer, or even maybe it does indicate maybe a poor prognosis.
Sure. Well, obviously, nurses, an important part of our role is to provide empathy to patients. So acknowledging the emotional impact of this news is going to be crucial, and validating a patient's concerns that they have that they're sharing with you when they do get the results back. And just really clarifying next steps, what they are or what they could be. So as I said before, explain additional testing that could come about later on. And another circumstance that we didn't talk about yet is maybe that the result came back saying that the quality was not sufficient. And sometimes that happens, but that doesn't mean that we're at the end of the road necessarily. So you could explain to the patient that that may mean that possibly a new biopsy would be ordered by the physician, or if a new biopsy or another tissue sample is not available, then maybe the physician would pivot to sending a blood specimen for the molecular testing. So that would be definitely some way that the nurse could support patients. And then finally, really providing hope for the patients as far as the future. So sometimes maybe the test results won't come back with any on-label recommendations based on the findings, but perhaps they do have some clinical trials listed that are an option for patients to look into. And then also just reaffirming that there's always emerging treatments that are coming out, not only treatments, but testing that's coming about for patients that have non-small cell lung cancer. So providing hope in the sense of letting them know about these future options that may be available to them.
Yeah, that's so important of just, we experience that as oncology nurses, new treatments being approved seemingly weekly. We're getting new emails about new indications or new first in class treatments. And so it's true. It's not just something that we say to make people feel better, that these treatments are really coming rapidly. What we have now won't be the only things that we have, in a month from now or a year from now. And so it's such an important part of reassuring patients and keeping their hope alive for sure. And so for oncology nurses, do you have any recommendations for tools or resources that are available that might help us stay informed and kind of grow our confidence in our role in supporting patients through this biomarker testing?
Absolutely. I do talk frequently to nurses, and one of the biggest resources that I always tell them about is the Oncology Nursing Society website. There is an enormous amount of educational modules on there related to this topic. So precision medicine, genomics, genetics, and you don't have to be a paying member to access these resources. You can just set up an account. There's a biomarker database. You can go through and learn about the different biomarkers or pathogenic variants. And it's just a really valuable tool. A couple other recommendations. Obviously, the NCCN guidelines are really important. These are regularly updated clinical practice guidelines that can tell you what molecular testing is recommended based on the patient's diagnosis and stage and the different targeted therapies and immunotherapies that are first line, second line, all sorts of information that is really valuable to a nurse. And then finally, if you work at a facility that has molecular tumor boards or even tumor boards, if you have the time to be able to attend those, I find those very informative. There's so many good discussions that happen in that format where they're talking about the biomarker, they're talking about the different treatment options. And that's really just a really good way to learn about this precision medicine space.
Well, as you mentioned, we do have quite a large variety of resources available on the ONS website in our precision Medicine Learning Library. And we've recently created a new case study to add to that resource as well. And this case study is helping to specifically cover what we're talking about today, which is the oncology nurse's role in non-small cell lung cancer biomarker testing. So how do you think this new case study activity will help nurses apply biomarker knowledge in more real-world scenarios?
I think these are so good because they really help nurses bridge that gap between theory and real-world application. So scenario-based learning helps the nurse practice interpreting these very complicated test results and being able to explain that or communicate the outcome of the test results to the patients, as well as the targeted therapy treatment plan. Also, it just reinforces critical thinking, as we all know is really important for nurses to encourage them to feel confident in their decision-making that they've made and that they're going to share with patients about the biomarker testing profile and the targeted therapy treatment plan. And then also it just reinforces how important team collaboration is. So coordination and conversation between the oncologist, the nurse, the lab staff to make sure that we have the best, speediest result for the patient so they can start treatment right away. It's really important.
And then based on kind of your involvement in creating this new case study, what do you think are some key takeaways for nurses to bring back maybe to their colleagues or their practice site after engaging with the case study activity?
Yeah, so there's a few definitely, maybe something that wouldn't have even occurred to a nurse unless she started to work in oncology and seeing these tests. But in the case of patients with non-small cell lung cancer, early testing is so important. So advocating for that prompt biomarker testing to be done, making sure that it's comprehensive, that it's actually looking for all of those, I think it was 12 biomarkers that I mentioned earlier in one of your questions, that this testing is done as soon as possible after diagnosis or progression. And that, something that I talk about all the time, personalized care, precision medicine really matters. So tailoring treatments for patients based on the biology of the tumor that's driving the cancer's growth is really crucial if you're going to be working as an oncology nurse. And then really another super crucial thing, because it's changing so quickly, is to stay informed. So use those trusted resources that I've mentioned before to keep up with these evolving guidelines and approvals that are happening, as you said, like weekly. Sometimes it feels like we're seeing them, especially for patients with non-small cell lung cancer, and empowering patients. So it's really crucial and important that we help our patients understand their diagnosis and treatment options that have come about because of this amazing molecular test and all of these new targeted therapies that are available for patients. And that we do that with clarity, that because we understand it, we can explain it to them, and also compassion and empathy.
Well, Vicki, thank you so much for joining me today on the podcast and talking about this very important topic, sharing what you think is important for oncology nurses to know, and talking a little bit about the case study that we're excited to share with all of our oncology nurses and our listeners today. So thank you so much for your time and your expertise and bringing this information to our podcast audience. Do you have any final comments you'd like to share with our listeners today?
I just really appreciate the opportunity to come on here and talk about something that's really near and dear to my heart.
Thank you so much, Vicki. Thank you for listening to the ONS Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.